Hello, friends. This is Samita, and I welcome Dr. Nabila Noor. She is both certified and fellowship trained Urogynecologist and reconstructive pelvic surgeon. And I welcome you to my show, which is Be With You. Here we discuss about everything from love to life and something more focused for something that could help women lead better lives. So we are here. I am a doctor myself. I am a dentist myself, and I know about gynecology, but I didn't have an idea about reconstructive pelvic surgery. So just tell us about your journey, about the studies and the degree that you have, and the work that you do.
Of course. Thank you, Savita, for having me. Really excited to share this platform and, discuss these very important topics. So as you mentioned, I'm a board certified and fellowship trained urogynecologist. I trained in the United States. So my background is in obstetrics and gynecology. So after medical school, I did my residency in obstetrics and gynecology. But after my residency, I wanted to subspecialize. So urogynecology is a subspecialty of obstetrics and gynecology. So that's 3 years of additional training that I did to be able to specialize in my field, where essentially I take care of women with pelvic floor disorders, which could include things like urinary leakage, bowel leakage. Excuse me. There are things called pelvic organ prolapse, a lot of trauma due to childbirth related complications. I also take care of women with pelvic pain, pain with intercourse, some bladder pain, as well as some reconstructive work with regards to any kind of cysts or any abnormal growth or developments in the pelvic area. So it's a whole gamut of things. A lot of it is surgical, but there's a fair amount of patient that I treat with non-surgical options as well. So it keeps it very interesting.
Yeah. So we know about gynecology. It is about, helping women give birth to their children. But what is exactly urogynecology and reconstructive pelvic surgery? And when does one need a person who is, qualified as such?
Yeah, no, that's a great question. So, obstetrics and gynecology is what we are more familiar with.
Yeah.
So, obstetrics is basically pregnancy related stuff, right? So, that's
Yeah.
when we're treating women who are pregnant, we're delivering babies. Gynecology is taking care of women for the non pregnancy stuff. So, that could be things like abnormal bleeding. A lot of women have problems with hormones, not getting their periods regularly, or having a lot of painful periods. So, that's straightforward gynecology. So urogynecology, as the name suggests, it's a combination of urology, which is dealing with your bladder and the genitourinary system, as well as gynecology. So urogynecology is actually a relatively new field, especially in the United States. We became a whole other subspecialty in 2013. So prior to that, we were under the umbrella of obstetrics and gynecology. And then we realized that we have this niche woman or patient population that needs very specialized care, that needs to combine multiple different fields, which is why, the name came about, because we need to do, for example, as a urogynecologist, I operate on the bladder, I operate on the urethra, and of course, gynecology being my background, so I'm operating on the uterus and the ovaries and tubes, which are our female organs, as well as a little bit of colorectal surgery, because your bowels are kind of in that field, the rectum, the anus. So we don't necessarily operate on the bowel per se, but it's all in the vicinity. So we have specialized knowledge from all three different specialties, which allows us to combine all our experiences and be able to take care of the patients who are suffering with these conditions in a more comprehensive way.
Yeah. So generally, the patients who come to you are the patients who are pregnant or post pregnancy.
So it depends. So I don't take care of pregnant patients per se,
Okay.
but a lot of what I see, a lot of women start noticing maybe towards the end of their pregnancy, and then maybe after pregnancy, they notice it becomes more pronounced. I'll give you an example. For example, urinary leakage, right?
Okay.
You'll hear a lot of pregnant women, especially in the third trimester, complaining that, they're having to go to the bathroom a lot, they're not being able to hold their urine anymore, or worse, sometimes they're having accidents because, maybe they sneezed or they coughed or they had a big laugh. Now, a lot of the times in pregnancy, it's because, you have a big baby that's putting a lot of pressure on your
Pressure. Yeah.
bladder, right? But the other aspect of it is that when you're carrying a baby for 9 months, that constant pressure on your pelvic floor, which is essentially the base of our body that's holding all our pelvic organs, which is the uterus, the bladder, the rectum, that pelvic floor muscle over time with so much pressure can get weak. And then think about what happens during childbirth, right? The process of giving a vaginal birth. There's a lot of stretching, there's a lot of damage to the nerves and the muscles. And again, that can weaken the pelvic floor, which subsequently can lead to problems with urinary leakage and bowel symptoms. And of course, a lot of women, as we know, have a lot of tear or laceration during vaginal birth. Or maybe they needed an
Yeah.
episiotomy where the surgeon has to make a cut artificially to get the baby out
Baby out.
quickly.
Yeah.
Or sometimes, we use instruments, for example, a forceps or a vacuum assisted vaginal delivery. And again, those can cause a lot of trauma to the pelvic floor, and subsequently, women may develop some of the conditions that I treat.
So generally, the women who have undergone a vaginal birth, uh, these conditions develop in them. Do they stay permanent, or do they, come back to normal naturally?
Right. And
This
it
one.
depends, right? Now,
Okay.
most women will have a lot of these symptoms for a short period of time,
Okay.
especially around the third trimester and then maybe immediately after their delivery. Now, if the symptoms persist,
Hmm.
usually we say about 6 weeks. If they continue to persist after 6 weeks, or they're seeing that the symptoms are getting worse, that's a time to talk to a specialist, at least get an evaluation done. Maybe it's nothing, or it may be like very early symptoms and we can focus on more preventative options, so that way things don't get worse. What happens is, and what is unfortunate is, a lot of women are told that, oh, these are normal things with pregnancy, right after you've given birth and you have a little bit of leakage of urine, yeah, that's normal, it will get better. Or if you feel like things are loose down there and it doesn't feel the same as it used to, that's normal. And then they have another child, and then maybe they had a third child, and the repetitive trauma can cause significant damage. And then, of course, fast forward 10, 20 more years as they go through menopause, once the hormones decrease, that causes even more weakness. So by the time patients come to see me, the trauma was probably done 20, 30 years
Years
ago, but
before.
because they waited and there's been so much damage done after and they haven't really done anything, then, that's when things get really, really significantly worse.
So after giving a birth to the child, their body undergoes changes, which are physical changes. Do these changes actually affect or have any, relation to them conceiving again?
Not necessarily, right? Conceiving is a completely different pathophysiology because that's more related to their hormonal status, and of course, like with the male partner, it also depends on the quality of this male
Sperm
sperm,
count, yeah.
right? So
Yeah.
that's more in the realms of the ovaries, and how much. What's the hormone status? What's the egg quality, and what's the sperm quality? What can happen, and where it becomes relevant is, say, a lot of women, maybe after a traumatic vaginal birth or because they have some pelvic floor issues, may have a lot of pain with intercourse afterwards. Or, they develop a lot of scar tissue vaginally, which makes it very difficult for them to endorse vaginal penetration. So that can indirectly affect them to be able to be intimate with their partner, and as a result, affect them being able to conceive. But just the pelvic floor issues themselves should not affect their fertility.
So these conditions generally occur in the way of normal birth, or do they also happen or occur in patients with cesarean?
Yeah, no, that's a great question because you're absolutely right. We do see that, of course, you've had operative vaginal delivery where somebody used forceps or vacuum assisted delivery or had an episiotomy, which is an artificial cut. Those women are more susceptible to developing pelvic floor issues. But having said that, cesarean section is not protective, right? So just because you had a cesarean section doesn't mean you cannot develop these symptoms. And the reason for that is, number one, it's the pregnancy itself that can cause a lot of changes as well.
Okay.
Genetics is a big risk factor, right? I have patients who've never been pregnant in their life and still have these pelvic floor issues. So genetics is a big component, and also your lifestyle, right? Obesity is a risk factor. So for my heavy patients, whether or not you've had children or have been pregnant, it's a big, it can be an issue. People who are chronically constipated, or people who have chronic cough because of smoking or other lung issues. It's that constant pressure on your
Pressure.
pelvic floor that can cause damage.
Yeah. So when a patient has such condition, they are not very open to, discuss, especially women are not really open to discuss about these things. So how does it actually affect their social life per
Oh yeah, I
se?
mean, yeah, no, absolutely. I think you're 100% right because these are things that are very embarrassing, truthfully,
Yeah.
to talk about. And patients get really emotional about it. Nobody wants to talk about leaking urine or like, leaking stool or having damage down there. Definitely, they feel very uncomfortable with their partner and sometimes not even their friends. And also because I'm a specialist, I may not even see these patients. A lot of these patients will probably go to their primary care doctor or their, general OBGYN. So unless your physicians are asking you, it's really difficult for them to share it. So I would definitely urge, and that's why, I do these talks and I like to talk about these conditions at different podcasts is to make women aware that these conditions are common. A lot of women have them, believe it or not, like almost 50% of women have some sort of pelvic floor issue. So it's very common, even though we think that, oh my God, nobody else is having it. I'm the only one suffering. That's because we don't talk about it. So I want them to know that these are common, but they're definitely not normal. So if your primary care doctor or your primary OBGYN is not bringing them up, but you're suffering and you're concerned and you just want to make sure everything is fine, talk to them yourself. Don't be shy, don't be embarrassed. These are very common pathologies. The good news is there are lots of treatment options. So ask them to give you a referral to see a specialist. And even if you don't want to do any surgery or do any treatment, at least talking to a specialist, you know what your options are, and then you can decide what's best for your lifestyle.
Yeah, because generally somebody who is, affected with this, it is behind their bathroom doors that it doesn't even come out in public.
Absolutely. And I'll,
Yeah.
I'll tell you, because, like I'm South Asian myself. So I understand the stigma that's associated with that, whether it's cultural or religious reasons. These are not topics like we don't talk about sexuality. We don't talk about female body parts. We don't talk about sex being painful or sex being enjoyable. These are very taboo topics. And again, that's why I feel so strongly about doing what I do and talking about it so much because I strongly believe that education is really key for everybody, but women generally, like even more so, because a lot of the times we don't even know our own anatomy. We don't even know what's going on, right? Like we don't even know what's the purpose of the uterus or the ovaries, right? Because I get this question all the time that, oh, if I have a hysterectomy where my uterus is removed, does that mean I'm not going to be able to have sex? Well, that has nothing to do with sex. It's completely different.
True.
And so the more we talk about it, the more we normalize the conversation, I think we're going to really help women feel comfortable bringing this up with their physicians.
So if not publicly, but does it really affect their intimate lives or the personal lives that women lead, and how, to what extent does it affect it?
Yeah, well, absolutely. I mean, it's a huge body image issue, right? I mean, think about, when women are stressed that they're going to leak urine, right? Whether it's with movement or any kind of exertion, there is something called coital incontinence as well, where some women will complain that they have a little bit of leakage of urine with vaginal penetration or with orgasm. And even if they didn't have the leakage, just the fact that it's in the back of their mind means they're not relaxing their body, they're not comfortable, and add to that that now they're having pain with intercourse, and they're even becoming even more rigid, which again is a vicious cycle. The more stressed out they get about it, whether it's a physical pain or emotional pain or like just being sensitive about these issues, makes their whole experience worse. And then over time, I see it very commonly among my patients. They avoid social gatherings. They avoid being intimate with their partner. They're afraid to go outside where they may not know where the bathroom is, and they're worried that they might have an accident. So they're clinically depressed. They are restricting themselves from enjoying activities. I have patients who miss their children's graduation or grandchildren's activities because they're worried that they're going to have an accident and not be able to get the help that they need. So there's a huge psychosocial impact that can happen. So it's not just about leakage of urine. It's not just about the pelvic floor issues itself. It's also the kind of the downside effect that it can
Yeah.
cause, whether it be on the emotional component, the physical component, as well as the psychological component of it.
Yeah. So like we talked about how it affects us physically and socially, how does it reflect upon the mental health, or does it have any connection with the post what do you call it, postpartum depression? Does it
Yeah,
have any
no,
connection?
absolutely. Of course, like postpartum depression is thankfully we're talking more about it, and
Yeah.
we're learning that it is a real thing. Now, there could be so many reasons why women have postpartum depression, right? There's so much hormonal changes going on. You have physical changes going through, and then a lot of women don't may not have help to help them with a newborn baby. So from my perspective, right, a lot of the times what I will see is say a woman, she's young in her 20s who just had a baby, maybe had a very traumatic delivery where she had a third degree or a fourth degree laceration, which essentially means that there was a rip all the way from her vagina almost into her anal sphincter muscles. I recently took care of a patient who had something similar. And yes, they repaired it, but the repair didn't heal properly. And she ended up with something called a rectovaginal fistula, which is essentially a false tract that formed between her rectum and the vagina. And as a result, she was having stool passing through her vagina. Right. So here's a woman who is in her 20s, who has a new baby, who is trying to adjust to the new baby and trying to take care of them. But at the same time, she's having stool coming out through the vagina. She is emotionally a mess, right? And she is worried that, oh my God, is this thing going to ever get fixed? And what is my husband going to think about? She thinks and feels like she smells of stool all the time. So you can imagine like how debilitating that is for the patients. And also what happens is a lot of the times we cannot do the surgery immediately because the vaginal tissue has to heal. Because, when that tissue is very raw and it's not something that we can fix immediately, it means that the women have to wait a little bit longer, which means that she's suffering during that time period. So that can also affect their mental health and can have downstream effects as well.
Yeah. So after that, I would like to ask you what are the treatment options that you have, what method to use, and what do you do to prevent something worse?
Those are all very good questions. So treatment options again depends on what pathology we're talking about,
Okay.
right? For example, if we're thinking about urinary leakage, there are some very specific non-surgical treatment options as well as surgical treatment
Yeah.
options. And same thing for bowel issues, same thing for pelvic organ prolapse. The one point that I do want your audience to take from this is that, like I said before, it's common, but it's not normal. And there are lots of treatment options. I think sometimes when patients think that they're coming to see me as a surgeon, that I'm only going to do surgery. And that's not true all the time, right? There are non surgical options that we can talk about. Of
Yeah.
course, they're not as definitive as surgery, but maybe I have a patient who don't want surgery or cannot take the time to recover from surgery. So we focus on more non surgical
No
treatment
surgery.
options. Talking about prevention, and I think that's where it's important for young women to know is prevention is really the key, right? So if you've just had a baby and you're starting to see some of these conditions we talked about, whether it's leakage of urine, whether it's a little bit of vaginal laxity where everything just feels very loose, or whether you're having bowel issues, you can always start with some pelvic floor strengthening exercises. And actually, those exercises are safe to do even in pregnancy as well as after. During pregnancy, make sure you talk to your OBGYN that there's no contraindication to do them. And the idea with the pelvic floor exercises is that you're strengthening your pelvic floor muscles so that they can support the pelvic organs even better. A lot of the times we talk about Kegel exercises, which is good, but the important thing to know is that you have to know how to do these exercises correctly. And I think that's where a lot of patients struggle. And if you're not sure if you're doing them right, then definitely working with a pelvic floor physical therapist is a great place to start, because these are therapists who are extensively trained in taking care of women who have these conditions. So they have a lot of experience, so they can really guide you and show you whether or not you're doing it correctly. And at the same time, for the new moms, right, it's not just about doing the pelvic floor exercises. There's a lot of learning how to maintain your posture, how to learn the correct body mechanics, because now you're doing a lot of different new body postures. For example, picking up a baby from the floor, right? Carrying a baby while you're breastfeeding, lifting those baby carriers. Those are heavy, right? You're probably hunching because, you're trying to kind of cradle the baby while you're breastfeeding. So if we don't focus on having the right body mechanics and right body postures, again, it can have downstream effects over time. So it's very important to focus on that. And again, it doesn't have to be crazy. If you cannot go to a pelvic floor physical therapist in person, there are lots of amazing, options online. There are lots of good physical therapists who have, a lot of good social media postings. And in fact, like I have a YouTube channel where I post regular contents about things like this, also very active on social media. So you can definitely follow us and get some good information to start with.
So, like we have talked about the condition which is not very commonly talked about, the physical aspects of it, the emotional, mental aspects of it. Now, can you just give me a message that you would like to give my listeners who are young girls and who want to be mommies in future, but at the same time they also want to be confident in their body after
Yes,
they.
absolutely. And I think that's where the prevention that we talked about, right? The first thing starts with understanding your anatomy, right? And so I think education is really key, which is why we're doing what we're doing.
Yeah.
And I think, like I said, there are lots of us physicians who are on social media, and there's a lot of valuable information. And obviously, you want to follow somebody who has the right background. So you just don't want to follow
Yeah.
anybody. Make sure it's valid information. So start learning about it. And when you're thinking about pregnancy, like, make sure, if you have an OBGYN, you talk to them. If there's any conditions that you're worried about, whether it's in your past history or previous surgeries, have an open discussion. A good OBGYN, a good primary care doctor will absolutely feel free to give you those information.
Yeah.
And then let's start with doing pelvic floor exercises, right? One of my pet peeves I always talk about is, like, why is it that people find out about my specialty only after they have had a traumatic experience and then they're coming to me as a result of? I should be making myself available even before, just like you asked me, like even before somebody's getting pregnant, right?
Yes.
And so that way, if you're thinking about pregnancy and or you're currently pregnant and you want to talk to a urogynecologist to learn about these even more, have your OBGYN give you a referral. Like we are thrilled to talk about these options, right? But focusing on knowing your anatomy, focusing on understanding what are some of your options. You can start doing pelvic floor exercises even now, right? Like start with doing Kegel exercises, just like when we work out in the gym to build up the rest of our body. Pelvic floor exercises should be a part of that. Like it should be a part of building your core muscles as well. But again, the important thing is to know how to do it right, because a lot of the times people or women try to focus on just strengthening the pelvic floor muscles, but equally important is learning how to relax those muscles. So these are the
Okay.
nuances that again, the more you learn about it, the more you work with a specialist, you'll be able to understand. And then afterwards, right? Say, God forbid, you had an unfortunate experience and now you're having repercussions, whether it be
Hmm.
pain or, incontinence or pelvic organ prolapse. Know that these are very common. I mean, this is all I see every day. So obviously I'm very busy, which means there's a lot of women who are suffering with these conditions, but know that there are lots of help. Don't feel embarrassed. Don't feel shameful. It's not something that you did that caused it. So do your research, find the right specialist in your area. And if you happen to be in the Lehigh Valley area, we're happy to see you. And yeah, please follow us on social media. Follow me on social media. I post weekly videos. And if there are any specific topics that you want to learn about, by all means, DM me.
Thank you so much, Dr. Nabila, for being such an amazing guest and giving us information and more knowledge about our own bodies, right?
No,
And
absolutely. Yeah, no, I
yeah,
really enjoyed it. Like I said, I feel very strongly and very passionately
yeah,
about this, and I think especially, I feel that as a fellow South Asian, from a cultural perspective, these are things that we don't talk commonly. Thankfully, things are changing, which is a good change. But I don't want young women to go into a relationship or think about pregnancy and not even know what could happen.
yeah,
The purpose of these conversations is definitely not to scare women, because I don't want them to think like, oh my God, Dr. Noor said all this, I cannot have a vaginal delivery. That's definitely not the case. A vaginal delivery, when it happens the right way, it's the best way to have a baby. It's the least amount of damage to you, because no surgery is without risks. So I definitely don't want, all your listeners to go out, kind of leave this conversation thinking that, oh my God, vaginal delivery is not an option for them. But what I do want them to understand is that yes, vaginal delivery when it happens is great, and that's where we see all the videos everybody's posting about their perfect birthing experience. But understand that there are also women who may not have had the most ideal, Instagram perfect birthing story, and that's just as common. It's just that people don't talk about it, and I'm here to tell you that can happen. But if it happens, don't blame yourself. There are options, and the goal is to just get you to the right physician, to the right specialist, so we can help you.
Yeah, it's about being aware of what you are, up to right now, and then being also having also the wisdom and the knowledge
Yes.
and approaching the right person who can help you out, right?
Yes.
And you were the right person for us today.
Yeah,
Absolutely,
no, I'm
this.
happy to help. And like I said, it's if and a lot of the times, I'll have patients come and say that, oh, you're the third physician that I'm seeing. And I always tell them, well, I hope I'm the last one, right? You don't have to go find somebody else. And the reason I say that is because sometimes, you may talk to somebody and you just don't connect with them for whatever
Yeah.
reason, right? Maybe the way they deliver the information, or you just didn't feel comfortable asking them a lot of the questions. Don't be shy to get a second opinion. I say that to all my friends. I say that to all my family members, and even my immediate family, right? Like if I was a patient and I had to
Yeah.
get something done, whether it's medical or surgical, and I talked to somebody, yeah, if I didn't jive with them, if I didn't connect with them, I would always get a second opinion, and that's absolutely okay.
So being comfortable and in your own skin and what you're going to, do in your
Yes.
life is the answer to
Absolutely.
it.
And then knowing what your options are. And I think that's really key, because a lot of the times I think, we feel that we have to suffer with this because
Yeah.
it just happened for whatever reason and there's no coming back. And I don't think that's true necessarily. Like, I don't think it's true for any aspect of life, definitely not in medicine, because there are lots of options.
Yeah.
And yes, you may be in a certain location where, the doctors who are available may not have the specialty, but with the internet now at your fingertip, it's so easy to find, so many providers. And even if you do not have somebody in your immediate location, you can always talk to somebody who may be remote and at least get the information that you need.
Yeah. At least knowing about what you're going through helps you a lot, right? Makes you aware. Yeah. So thank you so much for being here today, Dr. Nabila Noor. Also, we'll be tagging you below in my show so that my listeners, if they want any help, any questions, if they want to see your content, you will be there for them.